Thanks to a community that nurtured the seed planted so many years ago, EVMS has grown into a strong tree with roots firmly spread throughout the region. A tree with important branches that benefit all of us. High-quality patient care, rigorous health and medical education, and cutting-edge research. And these branches shelter us, providing economic benefit to Hampton Roads while helping us weather coming storms. Regardless of your politics, you would likely agree that our healthcare system is facing significant problems. You might even call it a looming crisis. Let's review a few numbers. The United States healthcare system is the largest in the world. It consumes over 17% of our GDP. That's almost $3 trillion. To put that in perspective, that $3 trillion accounts for nearly half the money spent worldwide for healthcare. But that spending covers only about 5% of the world's population. And if projections hold true, that spending may increase to somewhere between 25 and 30% of GDP by 2030. That's simply not sustainable. But at least if we spend money like that, we're getting a return on our investment, right? Not quite. In spite of the highest spending in the world, our healthcare system doesn't rank number one on any healthcare outcome measured. Not one. In fact, the United States ranks 36th for life expectancy, 39th for infant mortality, 42nd for male mortality, and 43rd for female mortality. Add to these concerns two others: inexplicable variations in the delivery of care and persistent issues in patient safety. Put simply, people don't practice medicine the same way from location to location. Granted, there's always some art to balance the science, but a more standardized starting point would benefit patients. The most recent study available on this topic indicates there were approximately 100,000 deaths a year in the United States attributable to patient safety errors. More recent studies confirm that, despite our best efforts, these types of problems persist. So if we're going to tackle these challenges facing our healthcare system, we have to find ways to bend the cost curve, change patient outcomes, and reduce variations in care. To that end, EVMS is making changes to our curriculum and will do an even better job training our future health professionals. We can't solve every healthcare problem, but we think we can be part of the solution, particularly in the area of modeling and simulation. ModSim is not a silver bullet. It's a toolkit, a combination of activities. And at EVMS, we think modeling and simulation should be one of the keys to lessening the looming healthcare crisis. We have a strong history in this area, and we're one of the leaders in the field. In 2001, Congress formally established the National Center for Collaboration in Medical Modeling and Simulation, a joint effort of EVMS and Old Dominion University. A $5 million gift given in 2012 is helping us accelerate our ModSim efforts in the Centara Center for Simulation and Immersive Learning at EVMS. Here are some examples of why it makes good sense to embrace ModSim. In medicine, we've relied on a 100-year-old apprenticeship model that trains medical students and residents by having them practice on live patients. Imagine if the aviation industry applied the same approach. You would never fly again, would you? Instead, pilots train hour after hour in a simulator, ensuring they follow procedures, master different types of airplanes, and are prepared for the unexpected. And they do all this training without placing any actual passengers at risk. Think about the possible applications of ModSim in medicine. There are currently about 1 million physicians, 3 million nurses, and 5 million allied healthcare workers in the United States. Each year, the FDA approves a host of medical devices and medications. How do those health professionals learn to implement the newest devices and treatments? How would you want them to learn? You've heard the axiom, practice makes perfect. Our experts will tell you this statement isn't true. They say, perfect practice makes perfect. Let's think about this in terms that might be more familiar. Consider the sport of golf. Practicing bad technique over and over only ensures that your muscles remember how to execute an unfortunate golf swing. The same holds true in medicine. The Centara Center for Simulation and Immersive Learning and the Portsmouth-based company Simus received a grant to develop AIMS, an automated, intelligent mentoring system. Remember those pilots with hundreds of hours of simulator training time? Wouldn't you like your doctor to have the benefit of that kind of practice? Take a look at the technology.
The AIMS system uses audio-based instruction and active visual cues and provides real-time feedback on the results of each session. The student logs in, selects the skill they wish to practice, and then they map in. The system calibrates to each unique individual by measuring their joint distances. As the student practices the skill, the system compares their performance to the expert model. The expert model is built by mapping the performance of several experts that perform the same skill. The system can detect slight procedural problems the human eye could not detect. For example, a laryngoscope tilted too far during intubation, which could damage the airway or break teeth. Leveraging off-the-shelf technology, AIMS allows students to practice a variety of skills as often as they need to, whatever time of day or night they want.
EVMS is also partnering with Northrop Grumman to help refine the company's immersive environment technology. Typically, this kind of system is installed in a room that allows for images to be projected on the walls. Computer-based avatars with artificial intelligence are embedded in the environment to interact with those being trained. The system is generally fixed in one place and is very expensive, costing at least $1 million. We're working with Northrop Grumman to refine their Virtual Immersive Portable Environment, or VIPE. The VIPE system would cost only about $100,000 and could be packed up and moved in about half a day. This makes it possible to move a high-quality immersive learning environment from hospital to hospital or business to business with a significantly smaller investment. If you've seen a doctor anytime recently, you probably have an electronic health record, a digital file that holds your test results and notes from patient visits. We're pretty good at crunching numbers from those electronic records, but not so good when it comes to the narrative components, those notes the doctor records about your visit, your symptoms, and planned treatment. Homeland Security uses natural language capabilities to monitor electronic communications looking for potential threats. But what if we could apply that same technology to electronic health records? What patterns might emerge? How might we improve your doctor's ability to diagnose problems? EVMS is working with Lockheed Martin to see whether their natural language capabilities can be applied to these types of analytical tasks. So clearly, there are significant health benefits to using ModSim, but there are also economic benefits. For example, most hospitals spend at least $80,000 onboarding each new nurse, training him or her on the specific operating procedures of the facility. We're developing a simulation program to speed that process. If we could shorten that 3-month onboarding period by about 2 weeks, we could save about $15,000 in costs for every nurse. That adds up. We are uniquely positioned in Hampton Roads to capitalize on medical modeling and simulation. ODU has the only integrated ModSim training program that moves students from bachelor's to master's to PhD, and graduates from those programs earn high salaries. In the past, Hampton Roads has relied heavily on defense spending, but those opportunities are vanishing. If we want to keep those companies healthy and thriving, if we want to safeguard our regional economy, we must help local companies transition to new specialties. EVMS can do that. EVMS can be a linchpin in helping them find new business models and leverage existing technologies for medical markets. After all, as big as the defense industry is, it's still only a third of the share of GDP allocated for healthcare. That's shocking. Make sure you get that. Defense spending is 5% of GDP. We spend 17% of our GDP on healthcare. Our leadership, our partnerships with companies such as Lockheed, Northrop Grumman, Siemens, Allian, CAE, and Mimic grow the health and economy of Hampton Roads. Let me say it simply. You're healthier, both physically and economically, because we're here. If EVMS did not exist, we would not have the high-quality healthcare we enjoy throughout the region.